I'm Dr. Stephanie Richcreek. I'm a board-certified family medicine physician here at Coshocton Regional Medical Center. Today I really wanted to talk to you about what a well woman exam is and why it's really important for your health. A lot of women believe that going to their gynecologist each year, every few years, to get a pelvic exam and breast exam is a well woman exam. And although those are parts of a well woman exam, there are a lot of other things that we need to talk about during a well exam to help you with your overall health and well-being. So what goes into a well exam? Well, I want to break that down a little bit for you so that you know, hey, this is what to expect. You're gonna think we're asking you a million questions, and we do ask a lot of questions, but that helps us guide where we're going with your health, where your concerns are, and what we need to monitor for. That helps us decide, hey, can we prevent some big diseases like blood pressure issues or diabetes? During those questions, we'll first talk about really what's going on with you lately. Have you seen a new specialist? Have you started a new supplement? Are you taking other medications that we may not know about? Getting your chart up to date. And then we go into some more social questions, such as, are you drinking a little more recently? Or have you cut out pop completely recently? Have you stopped smoking? Those type of things, because it helps us decide what type of testing we may need to do later. We'll then go on to screening tests. So are you due for a pap smear? Are you due for a breast exam? That type of thing. So for a pap smear, a lot of women think this is something that needs to be done every year. And it used to be done every year. Now we start at age 21 and it's every 3 years. Or once you hit age 30, it's every 5 years. Once you hit age 65, it's really determinant on if you're having any symptoms such as abnormal bleeding or anything like that. The big thing with a pap smear is we're trying to detect cellular changes. And if we find those cellular changes early, we're more likely to catch cervical cancer quicker, which means you're not having to go through as invasive of treatments. So they're very important to get in that time frame. Are you due for a mammogram? We actually start those at age 40 now, and they're every 1 to 2 years. And they're very important for the sheer fact of if we catch breast cancer early, we're more likely to be able to treat it with less invasive procedures. So getting those every 1 to 2 years helps us catch them when they're small versus a very big breast cancer. If you haven't had one and you're in your 50s or 60s and we find something and it's more invasive, we can move on from there with more testing and get you in with oncology as well. The next thing is a DEXA scan. And people are like, what in the world's a DEXA scan? And at age 65, we start screening women with a DEXA scan to see if their bones are thinning. So as you age, your bones thin as estrogen and progesterone decrease, and you're more likely to get hip fractures and back fractures if your bones are thinning. If we find that they are on these images, then we can start supplements, different exercise techniques, and some medications to help build up your bone strength. We'll talk about other screenings too while you're here that more than just women get, colonoscopies or home colon cancer screenings, lung cancer screenings, and a few other things. But those 3 are the big ones for women. We also talk about blood tests, and everybody's like, well, what all do you test for every year? Typically we test for anemia, which is low iron. We check your electrolytes to make sure everything's good there, like your sodium and potassium. And then we also will check liver and kidney function as well as cholesterol to make sure that we are preventing any issues with heart health later on. We can also screen for diabetes at that time. And if you're starting to get into that spot where you're almost diabetic, we can either start medications, diet plans, exercise plans. Some supplements sometimes help as well. And that helps keep you from getting diabetes. As a family medicine doctor, I want to prevent you from getting diabetes or have issues that you have to deal with the rest of your life and have to be on medications for. So that's a big thing with these screening labs. At the end, we always want to leave room for questions. I want you to really talk to me about what's going on. Are you having trouble sleeping? Have things been changing that you've noticed? Like, is your sleep habits changing? Do you feel more thirsty? Anything like that, things that you're concerned about. I don't want you to think, well, I can't say anything because she's already asked me all these questions. No, we need to be able to really see what's going on. That's why it's really important for you to come in once a year for these well exams so we can talk about your health, your well-being, and your longevity.